I almost disconnected myself.
Hey,
Hey, Greg. Hey,
hey, how are you?
I'm good. Thank you. I was wondering if you can tune into a couple friends of mine.
Glad to.
Yes. So both of them have back issues lately. The first one in her late 50s, early 60s. Last time I saw her, mid back around the back heart, back solar plexus area, the right side of the back was so inflamed. It almost looked like there's a hump on it. So I put the Blue Healer tonic and then spikenard, I believe. Can't remember what
Okay.
else I put on there. Maybe the marjoram tonic. Just wanted to get your
Okay.
on
So like if it like where's the pain? Is it like by the shoulder blade or it's a little bit lower?
back on the right side of the spine. It's almost like there's a mini hump there by the back heart, back solar plexus. It's just so tight
Tight and
that it,
inflated.
yeah.
Yeah. So here's the issue. Like we started to go down this a little bit when we were talking pain class, like way back in the day, and then even when we talk pain. But sometimes it's a little bit uh, like complicated is not the right word, but like sometimes you kind of have to rotate through some things because you're dealing with like some inflammation, and then when there's inflammation, it causes muscles to either lose tone or to like really constrict up. There's some toxicity because blood and lymph hasn't been moving through there. There can be several things. And so, I like the things that you did already. You're already doing spikenard that is calming to the nervous system, calms the sensory nerves, helps to relax the tissue. Um, the marjoram, very antispasmodic, helps to dilate vessels to get things to move through there. Blue Healer, very anti-inflammatory, also very calming and soothing to the emotional component. But like this is what I do. I'd kind of probably keep doing those things, but I would augment a little bit. And the thing that I would do is sometimes when something's been there, it's been there for a while, the body can get like we talk about toxicity, but there can be a lot of like inflammatory material in the tissue itself, right? And so one of the things that we've been doing is you want to kind of be able to open up the fascia, but sometimes you just really need to detox that particular area, and then it responds to the other things a little bit better. So like when we talk about things like arthritis and the joints and things like that, we talk about like deposits, crystalline deposits, just accumulated of just poor quality of blood in the joint and how it's impacting that particular area. And so, we look at that from the point of view of joints, but like when we see something up in the tissue, we kind of move away from that. Just as like a group way of thinking about it. But sometimes these things really need to be like detoxified, like the tissue. And the thing that we've been experimenting with, and I'm like over the moon with the result we're getting, is we're applying lovage directly to those areas. And so we had several people where they would have like a kink in their back or something, and they weren't responding, because of like it would feel better, and then the next day it would come back, and it would come better, and it would come back. And sometimes it's postural misalignment, sometimes it's all kinds of things sometimes. But so what we started doing is first like time or two, I would have them put like lovage, like neat, like right on the area. And then after a time or two of that, I would have them do the lovage body tonic. You can make it, or I think I've been making it privately for people, but I don't know that we put it up on the site. But when I make that for people, I usually put lovage with MSM in it, which is also very detoxifying, and then just rub it on the area. And I mean, it's a kind of a game changer. And then, still do the marjoram, still do the spikenard. If you feel that there's like a spasm that's just not unwinding, the pain relief antispasmodic or just wintergreen by itself can be helpful. Marjoram is a very good antispasmodic, but wintergreen, it's a pain reliever, but it also helps to unwind spasms that are so knotted up that it just won't release. And so you might want to put that in the mix.
Would
Mhm.
work have to be neat?
What's that?
Would wintergreen body tonic work, or do you think neat is better?
No, you could do it in a little bit of the body tonic, or you could put it in a little bit of like sesame oil. Like
Oh, okay.
you could put like 4 or 5 drops here, and then just a little tiny bit of sesame oil, and then rub it around, and then just rub it on the spot.
Got it.
And I don't know that she would have to go through a whole lot of it, because a lot of times if you can get it to unwind a little bit, then you can do like further treatment with some of the other things. But that it's up in that area. The other area of concern, because you just start kind of trying to make things better. Right? And so if you put marjoram on the spine, it helps to loosen it up, but sometimes there's a tension in the spine that is hard to unwind. And if that's the case, try putting helichrysum like directly on the spine. And it helps with lymphatic movement. It helps with inflammation, but also if there is some sort of like trauma-oriented energy, like emotional response, it doesn't mean that she had an emotional trauma and it put it there, but like sometimes when something's been so painful for a long time, it starts to cause like an emotional trauma response. And so it helps to unwind all that. Like it just, it doesn't matter which one's there. You just put some helichrysum on the spine and just, let it go. And sometimes they even have them inhale it, like put it on their back and then just have them like kind of lay on their side or on their back and just take some long, slow, deep breaths. And it's pretty good for unwinding the back.
Perfect. Thank you.
Yeah.
And then with pH, just flood it with green and then red.
I would
with
probably
red.
clean the spine quite substantially.
Oh, okay.
Yeah, I mean, the area, always going to that area is good, but I suspect there's some like issue there in the muscles where they're attaching to the spine.
Got it.
Yeah, that it's like bulging up like that is there's something where the muscle is attaching either there or to, the shoulder blade itself, wherever it's doing. That it's closer to the spine, it's probably more the attachment to the spine itself.
And one more, Greg, please.
Sure.
Yeah, so same, similar problem, but lower back. And this person has been doing a lot of meditations. So she feels it's emotionally related as well.
So tell me a little bit like how it's hurting in the low back.
She could not get up, and then she has a physical job. She's a therapist. So yeah, she says it's so tight that she can barely get up.
And it's low back. Does it hurt up and down, or does it hurt side to side, like across the back?
I think it may be side to side.
Okay, that's her psoas. So the thing with the psoas is you can treat the spots, but putting the digestive calm tonic on the whole abdomen, but especially on the lower abdomen, down in the belly button area and a little bit lower, just like cover that, have her do that a couple of times a day. And she got some really bad cords in her like lower centers.
Yes.
Yeah. And that looks like it's probably repetitive. Like if she's a therapist, that needs to be done probably daily, or little tiny bit concerned about her hips, but that could just be even from the cords.
Okay. So
Yeah.
sex chakra, basic chakra.
There, the perineum, and there's actually even like some cords to the lumbar area. They're not super big, but sometimes people's energy body's not the greatest like shot, and so they don't always hit the chakra. You know, sometimes they're just a little sloppy, and that's what it looks like. I would also clean the back of her legs, clean the sides of her hips and the knees. So you could use something that is very cleansing, like Palo Santo or chakra root cleanser or something like that. And that should unwind a lot of that. You probably have her use Rue on a regular basis, though. Like every day at the end of the day, Rue.
Got it.
Yeah. Yeah. And do you know her very well?
She's been coming to see me for over a year now.
Do you think she's like you know, sometimes when people are working with somebody, they get like a little bit attached to some of their clients, like really kind of concerned and empathetic? You think
Yes.
that's a little bit of an issue?
Yes.
Have her clean her cords as well. So ironbark eucalyptus or etheric cords, because you know, sometimes it's I mean, we're people, so it's hard not to have like some sort of connection with people that you're seeing on a regular basis. And sometimes it's not bad cords, it's like kind of good cords that get contaminated, and the iron bark is very cleansing to all of that.
And
Yeah.
do you see a lot of family issue related cords?
To that person,
Yes.
there's a lot of little cords, so that could be clients, family. Let me sit with that for a second. There's a bunch of little stuff up around her head, but some of that's even just thought forms that still could be therapy. You're familiar, like you use like a knife sometimes in healing, like, you know, to like cut things.
I now use the cardica.
Okay. Oh, even better. Go up around her head and like you know how like people in cartoons have like a little, like, looks like a balloon on a string coming out of their head.
Uh-huh.
Yeah, like it's like that. Like
Oh,
just go and just cut things off of around her head.
everywhere
She
I
got
see.
a lot of balloons around her head.
Got it.
Yeah.
And does the meditation have anything to do with that? Because all of a sudden she's